5 foods silently weakening your knee joints after 60. According to the CDC, nearly 1 in 2 adults over age 65 report symptoms of arthritis, with the knee being the most commonly affected joint. But what many don't realize is that dietary habits may be silently accelerating this decline, long before pain begins. Not all joint damage comes from injury or genetics. Studies show that certain foods can promote chronic inflammation, impair cartilage renewal, and contribute to long-term stiffness and weakness, particularly in the knees. These effects often build up gradually. Seniors may feel their knees are just aging, when in fact, their diet may be actively weakening their joints every day. In this video, we'll break down 5 specific foods widely consumed in the U.S. that may be contributing to knee joint deterioration after 60. Backed by science and explained in clear, practical terms. Because protecting your knees doesn't start in the doctor's office. It starts on your plate. Processed meats, hidden inflammation triggers. Processed meats are among the most common protein sources in American households, especially for older adults. Foods like bacon, deli ham, sausages, and hot dogs are quick to prepare and widely available. However, these convenient items may be silently contributing to joint inflammation and cartilage damage, particularly in the knees. The problem lies in compounds called advanced glycation end products, AGEs. These molecules form when meat is cooked at high temperatures, especially through frying, grilling, or smoking. Once inside the body, AGEs can accumulate in joint tissues and trigger immune responses that promote chronic inflammation, a known contributor to osteoarthritis progression. One 2010 study published in the Journal of Clinical Endocrinology and Metabolism found that AGE levels were significantly higher in individuals who frequently consumed processed meats. These elevated AGE levels were associated with increased joint stiffness, swelling, and reduced mobility, especially in weight-bearing joints like the knees and hips. Another concern is sodium nitrate, a preservative used to enhance the color and shelf life of processed meats. While safe in small amounts, long-term consumption has been linked to oxidative stress in cells, which can degrade collagen, the essential protein that gives cartilage its strength and flexibility. A 2020 analysis from Harvard T.H. Chan School of Public Health found that older adults with higher intake of processed meats had significantly elevated C-reactive protein, CRP, levels, a biomarker strongly associated with systemic inflammation and joint degeneration. Notably, these effects were observed even in individuals without diagnosed arthritis, indicating that damage may begin before symptoms appear. Processed meats are also high in saturated fat, which may further exacerbate joint problems. Saturated fat has been shown to interfere with collagen regeneration and increase the activity of pro-inflammatory cytokines, like interleukin-6, IL-6. These compounds not only accelerate cartilage wear, but may also increase fluid buildup in the knees, contributing to swelling and discomfort. Older adults often assume knee pain is an inevitable sign of aging. But small dietary choices, like daily bacon at breakfast or regular ham sandwiches, can quietly undermine joint health over time. The damage doesn't come overnight. It builds gradually, often unnoticed, until mobility declines. To reduce risk, seniors should limit intake of meats labeled smoked, cured, or preserved with nitrates. Instead, choose lean, minimally processed proteins like skinless chicken, baked fish, lentils, or low-sodium canned beans. These alternatives offer protein without the inflammatory load of ages or preservatives. When shopping, check labels for terms like sodium nitrite, hydrolyzed protein, or preserved. Even products marketed as low-fat may still contain harmful compounds. If the ingredient list is long and difficult to understand, it's often a red flag. This doesn't mean seniors must eliminate all convenience foods. But awareness is key. Gradually replacing processed meats with cleaner protein sources can reduce inflammation and better support joint longevity. And while processed foods slowly wear down your knees, many people overlook what they drink each day, even though it may be just as harmful to your joints. Sugary beverages, fueling cartilage breakdown. Sugary beverages are a staple in many American diets, including those of older adults. From regular sodas to sweetened iced teas and flavored coffee drinks, these liquids often seem harmless, especially when consumed in moderation. However, scientific evidence shows that high sugar intake may directly accelerate the breakdown of knee cartilage and promote systemic inflammation, both of which are key drivers of joint degeneration after age 60. When consumed, high-sugar drinks trigger a sharp rise in blood glucose and insulin levels. This spike activates pro-inflammatory cytokines such as interleukin-6, IL-6, and tumor necrosis factor alpha, TNF-A, which circulate through the bloodstream and settle into joint tissues. Over time, these compounds degrade collagen and impair the body's natural ability to repair worn cartilage, especially in weight-bearing joints like the knees. A landmark study by Boston University in 2014, published in the American Journal of Clinical Nutrition, tracked over 2,000 men and women and found that those who consumed one or more sugary sodas per day experienced significantly greater cartilage loss in the knee than those who consumed less or none. Importantly, this correlation persisted even after adjusting for body weight, suggesting that the impact was not simply due to excess weight, but from the inflammatory effects of sugar itself. Cartilage, unlike muscle, does not regenerate quickly. It lacks direct blood supply and depends on nutrients diffused through surrounding fluids. When inflammation is chronic, even at low levels, these fluid pathways become impaired, further slowing down the healing process. Over time, the structural integrity of the joint weakens, leading to symptoms like stiffness, reduced mobility, and discomfort when walking or climbing stairs. Many older adults mistakenly believe that switching from soda to fruit juice is a healthier choice. However, commercial fruit juices often contain as much, or even more, sugar than sodas, especially when labeled as from concentrate or 100% juice. These drinks can have up to 25 to 35 grams of sugar per serving, far exceeding the recommended daily limit for seniors, which is around 25 grams for women and 36 grams for men, according to the American Heart Association. In addition to glucose, many sugary drinks contain high fructose corn syrup, HFCS, which has been shown to inhibit collagen synthesis and increase uric acid production, another inflammatory trigger linked to joint discomfort and stiffness. It's also important to consider the behavioral factor. Sugary beverages are consumed quickly and frequently, often without awareness of total intake. A few sweetened drinks per day can silently build up to over 100 grams of sugar, placing constant stress on metabolic systems and joint structures. To reduce joint damage risk, older adults should aim to eliminate or minimize sugary beverages entirely. Better alternatives include unsweetened herbal teas, lemon-infused water, or carbonated water with no added sugar. These options provide hydration without contributing to inflammation or cartilage loss. Nutritional labels should be checked carefully, even for products marketed as healthy or natural. Look for terms like evaporated cane juice, fruit concentrate, or organic cane sugar, all of which still function as added sugars in the body. Beverage marketing often hides sugar under different names, but the effects on joint health remain the same. While sugar affects multiple organs, its impact on joint health is often overlooked, and because joint deterioration is gradual and symptomless in early stages, many people continue harmful drinking habits for years without realizing the long-term consequences. But sugar isn't the only threat. Even foods we see as soft and comforting may quietly erode the strength of our bones, and the knees often feel it first. Refined carbohydrates, accelerating bone loss. Refined carbohydrates are widely consumed in American diets, often without much thought. Foods like white bread, pasta made from refined flour, crackers, and pastries are convenient and familiar. But for adults over 60, these simple carbohydrates may be silently contributing to weaker bones and declining joint function, especially in the knees. Refined carbs are stripped of fiber and essential nutrients during processing. As a result, they are digested quickly, causing rapid spikes in blood glucose levels. These sudden changes trigger the release of insulin and promote systemic inflammation, which can directly impact the tissues and fluid surrounding the knees. Over time, this chronic low-grade inflammation may accelerate joint degradation, including the thinning of cartilage and the weakening of ligaments. The glycemic index, GI, of refined carbohydrates is especially concerning for older adults. High GI foods elevate blood sugar rapidly, increasing the production of pro-inflammatory cytokines such as interleukin-1V, IL-6, and interleukin-6, IL-6. These substances are known to contribute to the breakdown of cartilage and reduce the joint's ability to absorb shock and pressure. Research from the National Institutes of Health, NIH, 2018, has linked high refined carbohydrate intake with elevated levels of C-reactive protein, CRP, in seniors, even among those with no pre-existing joint conditions. High CRP is a reliable indicator of inflammation, and its presence has been strongly associated with increased risk of knee osteoarthritis and lower bone mineral density. It's common for older adults to start their day with buttered white toast, enjoy a sandwich on white bread at lunch, and have a dinner roll at night. While each portion may seem harmless, this daily pattern creates a steady glycemic load that promotes metabolic stress, particularly harmful to aging joints. Refined carbs also affect bone density indirectly. When blood sugar remains elevated frequently, the kidneys may excrete more calcium in the urine. This can gradually deplete calcium stores in the bones, especially in areas of frequent pressure, like the knees. Reduced calcium availability weakens the structural integrity of bones and may increase susceptibility to joint pain and even fractures. Another concern is that these foods are often low in magnesium and vitamin K, two nutrients vital for bone metabolism and joint support. Without adequate intake, the body may struggle to maintain proper cartilage hydration and bone flexibility, both critical for pain-free knee movement. To better protect the knees, Refined carbohydrates should be gradually replaced with nutrient-dense, slower-digesting whole grains. Options such as oats, brown rice, quinoa, or sprouted grain bread offer steady energy, reduce blood sugar spikes, and provide bone-supporting minerals. Unlike refined carbs, these alternatives help regulate inflammation, preserve calcium, and maintain collagen integrity. All essential for joint longevity. When shopping, it's important to read ingredient lists carefully. If a product lists enriched flour as a primary ingredient, or if sugar appears among the first 3 components, it likely offers little value for joint health. Choosing products labeled 100% whole grain is a more reliable way to support skeletal strength and metabolic balance. Refined carbohydrates may not cause pain immediately, but their regular consumption, even in small amounts, creates a metabolic environment that works against long-term joint resilience. And for older adults, that silent erosion may be felt most clearly when climbing stairs, standing up from a chair, or simply walking across the room. Processed meats inflame your joints. Sugary drinks dissolve your cartilage. But refined carbs? They quietly weaken the very structure your knees rely on to hold you up. Trans fats, silent joint destroyers. Trans fats are among the most damaging types of fat found in the modern diet. While awareness about them has grown in recent years, many older adults continue to consume trans fats unknowingly, especially through packaged snacks, margarine, fried fast food, and shelf-stable baked goods. Though their impact on heart health is well documented, fewer people realize that trans fats can also directly harm the joints, particularly the knees. Unlike naturally occurring fats, trans fats are created through a process called partial hydrogenation, which turns liquid oils into solids to improve shelf life and texture. But this artificial transformation also changes how the fat behaves inside the body. Trans fats have been shown to increase systemic inflammation, interfere with collagen metabolism, and accelerate the breakdown of joint-supporting structures. One of the most concerning effects of trans fats is their ability to elevate interleukin-1 beta, IL-1V, and tumor necrosis factor alpha, TNF-IA, both of which are pro-inflammatory cytokines directly involved in cartilage degradation. These inflammatory markers are not only elevated in individuals with arthritis, but also play a role in the early onset of cartilage thinning and joint stiffness, even before symptoms appear. According to a 2021 review from the Mayo Clinic Proceedings, diets high in trans fats were associated with a measurable increase in joint pain, reduced range of motion, and higher CRP levels in adults over 60. The inflammation caused by trans fats doesn't just affect the blood vessels. It can penetrate joint linings and trigger the immune system to attack its own tissue. What makes trans fats particularly problematic for knee health is that they can accumulate in body fat stores and remain there for long periods, continuing to affect cellular function even after intake is reduced. This prolonged inflammatory effect may impair the body's ability to rebuild cartilage and maintain joint fluid balance. Furthermore, trans fats may compromise lipid composition in the synovial membrane, the soft tissue that cushions the knee joint. This results in reduced lubrication, increased friction, and greater wear during everyday movements like standing, walking, or bending. Over time, these microscopic stresses may accelerate the mechanical breakdown of the joint. Despite regulations limiting trans fat content in many countries, including the United States, small amounts still appear in processed products, often under misleading names such as partially hydrogenated oils. These can be found in crackers, microwave popcorn, frozen pizzas, and commercial baked goods, especially those with a long shelf life. Older adults should read labels carefully and avoid any product that lists hydrogenated or partially hydrogenated oils among its ingredients. Even if a product claims 0 grams trans fat, current U.S. labeling laws allow up to 0.5 grams per serving without disclosure, meaning multiple servings can still result in harmful intake levels. Healthier fats, such as those found in olive oil, avocado, nuts, and cold water fish like salmon, provide anti-inflammatory benefits and support joint function. These unsaturated fats help maintain cell membrane integrity and promote the production of compounds that reduce joint inflammation rather than increase it. Unlike refined carbs or sugary drinks that work indirectly, trans fats have a direct biochemical impact on joint structures, making them one of the most dangerous hidden threats to knee health after 60. And because their effects linger in the body long after consumption, the damage can continue silently for months or even years. Avoiding trans fats isn't just a heart-smart decision, it's a joint-saving one. But there's still one more common ingredient that many seniors overlook, and its effect on knee stiffness and swelling may be more immediate than you think. Excess sodium, triggering knee swelling and stiffness. Sodium is an essential mineral that helps regulate fluid balance, nerve signals, and muscle function. But for older adults, especially those over 60, too much sodium can quietly contribute to knee stiffness, swelling, and joint discomfort, often without any obvious warning signs. While its link to high blood pressure is widely known, fewer people realize that sodium plays a direct role in how joints retain water and respond to pressure. When sodium intake exceeds what the body needs, it alters the osmotic balance in cells and tissues. In the context of joints, this can cause fluid retention inside the synovial membrane, leading to swelling, reduced range of motion, and a sensation of tightness or pressure around the knees. Seniors who experience puffy or stiff knees, especially after eating salty meals, may be seeing this effect in action. A 2017 study published in Arthritis and Rheumatology found that individuals over 60 who consumed more than 2,300 milligrams of sodium per day had a significantly higher risk of joint flare-ups and knee stiffness, even in the absence of formal arthritis diagnoses. Excess sodium was shown to promote the expression of pro-inflammatory cytokines, particularly IL-6 and MCP-1, within joint tissues. These molecules contribute to both inflammation and cartilage breakdown, creating a double impact on knee health. Sodium also indirectly affects joint stability through its relationship with calcium. High sodium intake can increase urinary calcium excretion, which over time may lead to gradual calcium depletion in the bones, especially concerning for load-bearing joints like the knees. This mineral loss may not be immediately noticeable, but over years it can lead to weaker bone support and increased joint vulnerability. Consider a typical daily pattern. An older adult might start with toast topped with salted butter, enjoy canned soup or deli meat for lunch, and finish the day with a frozen entree or takeout meal. Each item alone may not seem excessive, but together they can easily push sodium intake over 3,000 milligauss, far above the 2,300 milligauss daily limit, recommended by the CDC, and well beyond the ideal 1,500 mg limit for individuals with high blood pressure or kidney concerns. Compounding the problem, many high-sodium foods don't taste overtly salty. Items like bread, cheese, salad dressing, and breakfast cereals can contain substantial sodium content, even if they don't trigger a salty flavor. This makes unintentional overconsumption common, especially for those not actively monitoring their intake. To reduce sodium-related joint stress, older adults can gradually shift toward fresher, less processed food choices and begin paying closer attention to ingredient labels. Watch in for words such as sodium, salt, or monosodium glutamate can help identify high-sodium items. Opting for products labeled low sodium or no added salt is also an effective way to manage intake without drastically changing the overall diet. Unlike some dietary changes that feel restrictive, lowering sodium intake can be simple and sustainable. Replacing salt-heavy seasonings with herbs like basil, rosemary, or garlic powder not only enhances flavor, but also supports cardiovascular and joint health. More importantly, it empowers seniors to take small steps toward better mobility and comfort without relying on medication. Awareness of hidden sodium is equally important. Condiments, sauces, and even so-called health foods can contain unexpected amounts of salt. Paying attention to serving sizes is critical, as products may appear acceptable per portion, but quickly exceed healthy limits when consumed freely. Over time, reducing sodium intake can lessen joint swelling, improve flexibility, and reduce discomfort in the knees. For many older adults, even a modest drop in sodium can lead to noticeable improvements in how their legs feel during daily movement. Processed meats inflame. Sugar dissolves cartilage. Trans fats linger in your tissues, and refined carbs erode your bones. But sodium? It floods your knees, quietly filling every step with more pressure than you realize. The foods we choose every day don't just influence weight or blood pressure. They directly affect the strength, flexibility, and long-term health of our joints. As we've shown in this video, processed meats, sugary beverages, refined carbohydrates, trans fats, and excess sodium can each contribute to inflammation, cartilage damage, and weakening of the bones that support your knees. For adults over 60, these effects are often silent at first, making early awareness critical. The goal is not to eliminate every risk immediately, but to recognize the patterns that may be accelerating joint wear and to begin making smarter, more informed choices. Small changes, like replacing processed snacks with fresh foods, switching to unsweetened drinks, choosing whole grains, using olive oil instead of margarine, or checking sodium content on labels, can all help reduce pressure on your knees and support mobility as you age. At Health 1900s, we're committed to bringing science-based health insights tailored for those born in the 20th century. If this video helped you understand the hidden connections between diet and joint health, consider subscribing for more clear, practical guidance for long-term well-being. And as always, speak with your healthcare provider before making significant dietary changes, especially if you're managing chronic conditions. Your knees carry you through life, and what you eat helps determine how far they'll take you.